know, besides if you've done root-planing skin on these teeth, have mobility, what is the purpose of saving some of these teeth, whether they be full arch or a single tooth here and there? We're probably just festering more bacteria over time, more alveolar bone loss. We're going to end up with less bone to place implants.